Dr. John Szetu is an eye surgeon and director of the Suva-based Pacific Eye Clinic, which is run by the Fred Hollows Foundation. He was born and educated in Solomon Islands, but left to pursue a medical career studying in Papua New Guinea, Australia and the UK. His dream was to gain the necessary skills to open an eye clinic in the Solomons to help his fellow countrymen, afflicted by cataracts, corneal ulcers and eye injuries. But that dream turned sour in 1999 when he was forced to flee his homeland. His attempts at returning and fulfilling the dream have also frustratingly floundered. Today, John Szetu works out of Suva, training eye doctors and nurses to work throughout the Pacific.
He's contributed in everything: human resource, surgical services, administration in setting up eye institutes, or even eye care programs. He's done everything.
I'm really quite overwhelmingly proud because there was nothing. At Square One, there was nothing at all. We started right from the beginning, from scratch. During those days, there was not many doctors around, so I had to take up a lot of responsibilities at the same time in a small hospital in Honiara. Well, we had a lot of eye teams from Australia and New Zealand visiting the islands, and there wasn't many, local doctors around, so I was asked to be attached to these teams, and that's how I started working with them, and that's how I developed my interest in ophthalmology. So
it's like he's been the main patient behind all the eye programs in the Pacific, though. Solomon Islands National Eye Care Program is John. Vanuatu Eye Care Program is John. And Pacific Eye Institute is John. I mean, he's behind all those things. I
started seeing patients. After acquiring new skills, I started providing basic eye care services, see very common basic eye conditions, and then treat what I could treat. It gives me a lot of satisfaction, a lot of sense of like, hey, you're contributing to the prevention of blindness drive, like is happening everywhere else, and you are making one more person see, one more person who will become productive again, rather than so dependent on others, relatives, and non-productive at all for the rest of his or her life. So I keep on returning to the Solomons. Well, home is always home, and you think about the people who cannot afford. I mean, without ophthalmologists, the people will be there. I mean, overseas teams come in and out, but that's not the answer to the problem. You need a permanent service that is on the ground, delivering services right down to the rural community level. I
still have the belief that, like John believes, that I have to come and support the country. And we want Solomon Islands to be the front runner in eye care in the Pacific.
Yes, once the situation was escalating, it was no longer safe for the family, so I had to send them off to Gizo to lay down low while the situation improved. So it improved, so I recalled them. And when I went to Australia for a meeting, thinking everything was okay, it just exploded, and that's how that caused a turning point of my path. The health services in the region are very, very poorly delivered, poorly developed, with no funding, competing demands, and so usually eye care services get left behind. Eye care services get neglected, so it's all the more reason that we need people to push the Ministry of Health, push the governments that blindness prevention is a priority as well. Vanuatu had never had any eye care services, just like the Solomons 10 years back. So I was there mainly to set up a program and to train human resources so that they can run the program. So I managed to do that. We set up two well-equipped eye clinics in the span of the 5 years project when I was there, and trained 11 eye nurses as well, and 1 doctor. What I had accomplished in the last few decades, I think it is a really good example to those coming behind to see what I have achieved. so that they can take it further to make it even more bigger achievement.
And he's kind of a person that if he thinks that something has to be done, he has to do it. And his dream comes true now. See, Pacific Eye Institute. That sort of vision.
It's better to teach a person how to fish and let him fish for himself rather than come in and fish for him, because otherwise it's not sustainable. You have to empower them, capacity building, and show them the ropes, and actually have them to provide the services themselves rather than be totally dependent.
And he came in and said, what if we take you into ophthalmology? You can still do operations, I mean surgeries, but it's more microsurgery. And I said, John, whatever comes my way, I want to go and do my studies now. So that's how I went into ophthalmology. So he's like, he just came in suddenly and said, there's a door here, let's open the door and see what you can do.
I know that when I slowly withdraw, when I slowly step aside, I know that eye care can move forward with these young doctors coming up forward and progress and advance to take it further.
There'll be no other like John.